Hey, this is Doc Erik. Welcome to my YouTube neighborhood, the channel where we give you one mindset tip and one body set tip rolled into one video. Today we're going to be talking about why you should care about the glute medius. So let's jump in. Typically, when we look at patients that come into the office who report lower back pain or hip pain or knee pain, we typically want to check and see what the muscle tissues are doing around the hips. The hips are important because they are the connection point between the lower back as well as the knee. One of the major muscles that we find at fault is a combination of either the glute max muscle or the glute medius muscle, which is what we're going to be talking about today. So the role of the glute medius muscle is it acts as a dynamic stabilizer during single stance and movement-based motion. It's highly involved in things like walking, running, jumping, lateral movements, and things like that. Anybody who is developing a weakness into this muscle or an overuse into these tissues is typically going to start to notice some sort of lower back pain, some sort of hip pain, some sort of weakness on one side of the body versus the other, and potential knee pain as well. One of the things that we look for from a clinical presentation is we have the individual standing on one leg. We have one leg raised to roughly 90 degrees, and we have them standing on the opposite leg. And if we see some sort of a hip drop on the leg that is bearing weight, then that's typically a sign that glute medius may be an issue over there. We also compare it to the opposite side to make sure that there's not a bilateral presentation. So we always want to evaluate both sides of the body, not just simply treat the symptomatic side. In terms of evaluation, one of the ways to see if glute medius is active versus inactive is something called active range of motion versus passive range of motion. So active range of motion is when the individual, being you, actually takes the muscle through a range of motion. So for example, you may be laying on your side and you'd be raising your leg up. So for example, if this is the bottom leg here and this is your top leg and you're laying on your side, you would raise your leg up and you would lower your leg and you would raise it up again and you would try to find as high as you can bring up that leg before pain ensues. From a passive perspective, this is typically done in a therapeutic setting where your therapist will actually bring up the leg. So the therapist will actually be doing all of the movement and you're just laying there passively. The difference between the active range of motion score and the passive range of motion score, you're going to see a difference. Typically during active range of motion, there's only so far you can take the muscle through a range of motion before it becomes painful or tight. Passively, because you're doing no work, the therapist is actually able to take the muscle through its true range of motion. So we typically see more range of motion from a passive pass versus an active movement. So after you've been evaluated by your therapist and they found a discrepancy between active range of motion and passive range of motion, typically what we're looking at is a weakened muscle that requires strength. One of the ways to strengthen a weakened muscle is to help enhance motor control, endurance, and overall strength. So typically what your therapist will do is they'll have you go through several different phases of care. So the first phase will typically very entry-level non-weight bearing and weight-bearing exercises. These could be things like the clamshell, side-lying hip abduction, standing hip abduction, single leg balance drills, and of course everybody's favorite, those lateral banded walks. So those monster walks where you see people with a band around their hips walking to the left and walking to the right. During the second phase of care, you're going to graduate to more weight-bearing exercises, stability exercises that are challenging you against gravity. These can be horizontal drills, for example, where you're going up and down on a box, for example, or laterally stepping up and down on a box. You can also do diagonal drills as well. As you continue to move through phase 2 drills, you can start to add uneven surfaces to work on balance and stability, or you can also increase the amount of weight that you're using during these drills. The third and final phase is typically seen for the athletes only. These are individuals that we're trying to have them return back to sport. So phases 1 and phases 2 are typically best for the general population, and for phase 3 exercises, that's typically the return to sport for the athlete, whether it's a jumping sport like basketball, an explosive sport where you're doing a lot of lateral movements such as football or possibly soccer, or even something like hockey. So the mindset tip and the body set tip for you today is if you're somebody who's experiencing pain on the side of their hip and they're not quite sure where to turn to, a good place to start would be a chiropractor or a physical therapist, somebody who can take you through a range of motion and an evaluation to see what range of motion you have access to and where there's still room for improvement, and whether the muscle tissues need to be strengthened, whether you need to work on power, whether you need to work on stability or endurance, or a combination of all the above. And if you like content like this, don't forget to rate, review, and subscribe. We love it when we get new visitors to our YouTube channel. It helps us grow the channel and also answer important questions like this that we receive either through email or through my office in person. And until next time, stay healthy.